Hello and welcome. This is Health Talk. I'll be your host, Njabula Majosi, and tonight we'll be continuing our series on knee injuries. Specifically, we'll be discussing meniscal injuries. So, coming up for you on today's show, we'll be talking about what is a meniscal injury, where is the meniscus, and how you come to injure it. Furthermore, we'll be discussing how meniscal tears are managed, and we'll be demonstrating some home exercises you can do.
A meniscal tear is a condition that causes knee pain and other knee symptoms. It happens when part of the knee joint, called the meniscus, tears. The meniscus is the cushion of rubbery material or cartilage between the thigh bone and the shin bone that makes the knee joint more stable and acts as a shock absorber against forces and loads. There are different kinds of meniscal tears depending on the part of the cartilage that tears and how it tears. A meniscal tear can happen suddenly, such as during a sports injury. It can also happen slowly over time as a result of repeated injury or gradual wear and tear over time. This is more common in older adults. What are the symptoms of meniscal tear? Symptoms of meniscal tear can include knee pain, knee swelling from a collection of fluid around the knee locking, not straightening away, or feeling like it catches on something as it straightens, the knee giving out, feeling unstable or feeling like it won't support you, and knee stiffness. Is there a test for meniscal tear? Yes. Your doctor or nurse will ask about your symptoms and do an exam to check your knee and your leg and how it moves. They will then also do x-rays and an MRI to confirm their findings. If your tear is small on the outer edge of the meniscus, it may not require surgical repair. As long as your symptoms do not persist and your knee is stable, non-surgical treatment may be all you need. RICE. The RICE protocol is effective for most sports-related injuries. RICE stands for rest, ice, compression, and elevation. Rest. Take a break from your activity that caused the injury. Your doctor may recommend that you use crutches to avoid putting weight on your leg. Ice. Use cold packs for 2 minutes at a time, several times of the day. Do not apply ice directly to the skin. Compression. To prevent additional swelling and blood loss, wear an elastic compression bandage. Elevation. To reduce swelling, recline when you rest and put your leg up higher than your heart. Non-steroidal anti-inflammatory medicines are drugs that reduce the pain and swelling. If your symptoms persist with non-surgical treatment, your doctor may suggest arthroscopic surgery. Knee arthroscopy is a procedure where a miniature camera is inserted through a small incision or portal, which provides a clear view of the inside of the knee. During this procedure, your surgeon will decide to either do a partial meniscectomy, which is trimming away of the damaged meniscus, or a meniscal repair. Rehabilitation is a key component of management of all types of meniscal tear injury. These range from home exercises to exercises done with your physiotherapist.
And now, Dr. Balfour will be demonstrating some of the rehabilitative techniques.
Hi there, I'm Dr. Balfour. I'm going to be showing you a few exercises for meniscal tear injuries. So, our exercises are split into two. One, isometric exercises. These exercises keep the joint stable. And then the other exercises are dynamic exercises, which actually improve your range of motion of the joint and help to strengthen the muscles around it. So, first of all, we're going to start off with the isometric exercises. These are the exercises you start off that you can do in bed, you can do sort of easy exercises, anything goes. So what we need is a jersey, a towel, anything that's going to lift the heel of the foot up. I'm just going to ask the patient to lie down. So what you do is just put the towel, jersey, whatever it is, under the patient's heel, like that, just lifting the leg up slightly. You then ask the patient to move their knee towards the bed. As you can see, towards the bed. And you can ask them to keep it there for 3 to 5 seconds. That is the first exercise. Now we can get rid of the towel. For the second exercise, we're going to ask the patient to lie on their side. And all you want the patient to do is lift their leg up and keep it there for a few seconds and bring it back down. Okay. As you can see, this keeps the joint stable and keeps it not moving. Now to improve your range of motion, we're going to do dynamic exercises. So our first dynamic exercise is to put the patient on their back, and all you want them to do is to slide their heel on the bed all the way up, like that. As you can see, that flexes the knee and increases the range of motion. And you can ask them to slide it back. The whole point of this exercise is to keep the heel on the bed and back again. As you can see, you can do this exercise on any flat surface. Our second dynamic exercise are just normal leg raises. Ask the patient to be on the edge of the bed, and all you want them to do is to lift one leg or both legs up and back down. Our third and final exercise is short squats, or half squats as they're called. All you want the patient to do is stand a shoulder width apart and then to squat halfway down. Perfect. One more. And those are the 5 exercises you can do for meniscal tear injuries.